The problem is a puzzle. Each piece reveals a little more. In this veteran's medical bills and past due statements, we see the demand for dollars, the decimals and desperation. They come from doctors, bill collectors, and nicer sounding but just as demanding reimbursement specialists. This is the puzzle the Department of Veterans Affairs needs to solve.
But the bills is what bothers me.
Eduardo Montalvo's puzzle has a lot of pieces. The Vietnam veteran lives a quiet, peaceful life in a small mobile home park in Edinburgh. That peace and quiet was quickly shattered when we started talking to Eduardo about payment problems at the VA.
Those pencil pushers, that's how they are!
Eduardo is fed up with the VA Texas Valley Coastal Bend healthcare system in Harlingen. That mouthful of bureaucracy is the VA's solution to healthcare for veterans in the Valley. It's not a hospital. Coastal Bend contracts private doctors and hospitals for veterans treatment.
They say, hey, well, it's be too expensive to have a hospital here. We'll contract these local hospitals. Fine, contract them, but pay the bill.
Here's how it's supposed to work. Veterans like Eduardo go to the doctor. The doctor bills Coastal Bend for fee-based services. Coastal Bend pays the bill.
Never supposed to see it.
Eduardo's stack of puzzle pieces shows that rarely happens in his case.
$601 for this last bill. Not just bills, I get calls from them. And that bothers me, you know what I mean? And calls, threats that they're going to refer me to collection agencies.
It was horrific.
A former high-level employee at Valley Coastal Bend helped us put these pieces together. He worked in the fee office that processed payments.
We couldn't pay their bills.
According to public information requests filed by Channel 5 News, Coastal Bend owes roughly $900,000 for veterans care. It used to be much worse. At one point, the Knapp Medical Center alone was owed roughly $1 million. This whistleblower says when some doctors and hospitals didn't get their money, they billed the veterans directly.
And I keep telling them, bill the VA, bill the VA. And they don't because the VA won't pay.
Many veterans appealed their denied claims to Coastal Bend. This whistleblower says those appeal letters were ignored.
They were put in the bottom of 2 filing cabinets and sat there for years.
Their appeal letters were sitting in a drawer
Yes,
at Texas Coastal.
yes. And the fee staff was told not to open them.
How many letters are we talking about?
Hundreds.
Hundreds of forgotten veterans. We went to Coastal Bend.
True statement. That is a true statement. We found out about this the hard way, I guess, because it was a total surprise to myself and to our leadership.
Spokesman Hugo Martinez says the new VA administration in Harlingen found those letters late last year.
We are getting caught up with processing all of these appeals.
They have a lot of work to do. 114 appeals are pending at Coastal Bend, including the forgotten files. More than half are roughly 2 years old. Martinez says some appeals will be denied.
Sometimes the appeals are because the patients go to the emergency room when it really wasn't a true emergency, and that's where a service may be denied.
That means some veterans will keep getting billed.
They threaten me with taking me to court, and I tell them, go ahead, sue me so I can sue the VA.
It's not just veterans and former employees who are frustrated with the system. Our federal government warned the VA about these problems earlier this year. The Government Accountability Office found VA facilities across the country are at risk for inappropriately denying claims.
They're supposed to pay for everything, but yet I get the bills from the hospital.
It means Coastal Bend is just one small piece of the puzzle, one part of a bigger problem. Joe Augustine, Channel 5 News at 10.